Welcome to the Population Health Management Podcast, brought to you by Lightbeam Health Solutions. My name is Laurel Durr, and I will be your host for today's episode. Hello, everyone. Today we have two very special guests. If you've tuned into past episodes, you know both of them. First one we have today is Christine Denoya. She's a registered nurse and our director of clinical programs here at Lightbeam Health Solutions. And we also have Shelly Davis. She's also a nurse and our clinical engagement manager here at Lightbeam. So welcome back, both of you.
Thanks, Laurel. It's great to be here as always.
Thank you, Laurel. Thanks for having me. Thanks for doing this with me again, Christine.
It's a lot of fun, all of our podcasts. So I'm glad that we could get together again. This month is Pride Month. So we kind of wanted to talk about spreading awareness for these patient populations. And there are a lot of care barriers that do exist. So we really wanted to get into educating people and letting you know some of the ways that Lightbeam can help. Shelly, do you want to share a little bit more with us about Pride Month?
Absolutely. Pride Day is actually June 28th, but Pride Month is celebrated for the entire month of June. It's really an opportunity to spotlight concerns of the LGBTQIA community. It's an opportunity to memorialize those that were lost to hate crimes, to violence, to HIV/AIDS, for advocacy and education. So it's really a wonderful time to spotlight that particular community. And it's one of the reasons why we wanted to spotlight it here at Lightbeam for this month.
So first, I wanted to start off with some of the health concerns that this population faces. Can you elaborate a little bit on those?
Absolutely. What we do know and what research has shown us is that depression among those who identify LGBTQIA is higher than the general population. Youth are 2 to 3 times more likely to attempt suicide. This particular patient population is less likely to undergo preventive health screenings for cancer. Some of that relates to the gender with which they identify. It may not necessarily be consistent with the organs that they were born with under their assigned sex. So they're a little bit hesitant to come in and get those particular screenings. There is a higher risk of HIV and STI transmission. And again, that's what we've seen in research. More likely to experience some impact to their social determinants of health through housing insecurity. There's an increased incidence of obesity. They're also more likely to be victimized or victims of domestic abuse, and some of the barriers associated with that is just the reporting and having a trusted provider that they can talk with about it. And then lastly, what we've seen is a greater incidence of alcoholism, illicit drug use, and tobacco use. So all very important aspects of health to address with a patient population.
So some of those things that you talked about, Shelly, are related to the barriers that they are seeing within the healthcare, which include those discrimination and ignorance and fear. And having the lack of informed care, having caregivers that don't have the sensitive language or don't have the available research and data really prevents them from getting the access to competent routine care and screening that they deserve. And so there's the LGBTQIA health is really emerging as a very big national concern due to the growing body of evidence, indicating that there is really a significant health disparities experienced by this community. So some of the things that we want to talk about next would be to look at some of the aspects for your organization to consider.
I agree. And I think, Christine, I think you brought up some great points. And in every state now, same-sex marriages are legal, and that opens up benefits to those same-sex partners. The Affordable Care Act in 2016 and additional updates have made some changes that, again, are so beneficial and so very important that most plans, including CMS plans, now cover medically necessary hormone therapy. They also cover sex reassignment surgeries. One of the more frustrating aspects for providers' offices and for patients themselves is the appeals process that used to be required, that if a preventive health screening was performed on somebody who identified as male but was born with female organs, oftentimes that claim would be declined or denied based upon the sex and the procedure code that did not seem to be congruent. So I think that the Affordable Care Act has alleviated some of that, in that those requirements are no longer, that barrier is no longer in place, which makes accessing care and receiving quality of care better. There's also some sensitivity around ensuring that organizations are knowledgeable, to have access to bathroom facilities, to have appropriate room assignments, to make sure, as you said, to use appropriate language, to really build that important relationship of trust and an open, sort of warm atmosphere, so that honest communication can take place.
So, Shelley, a quick question. So I know CMS has changed a lot of these guidelines, and they now cover a lot of those items that you listed out, but that's just CMS. There's still a lot of commercial insurances that haven't jumped on board, but we know that generally they end up following what CMS starts. So hopefully in the near future, we'll see the commercial insurances, the commercial plans kind of follow suit with what CMS now covers. We need to make sure that we consider that when working with these patients to see what their plan is. So some of the tips I got from Nurse Doc were to be aware of some of the key LGBTQIA definitions, and to also deepen your knowledge of the LGBTQIA community, so that you are able to apply that to provide the optimal care for that particular community. Also, you want to create a welcoming environment for those patients, and you want to use some inclusive languages. In other words, when you're talking about relationship status, you would want to use married, partnered, or other. So when asking patients to provide their names, it's also helpful to include an additional space indicating your preferred name, so that you don't make any assumptions. Also, you would want to use some neutral language, so you can approach each interaction with open-mindedness and not in a non-judgmental attitude. So for instance, you could use language that changes a nursing mother to currently nursing.
That's fantastic. I agree, Christine. I think there's also an opportunity, just like with any other patient that we encounter, asking how they would like to be referred to. Some of my patients prefer to be referred to as Mr. Smith, whereas others would prefer to be referred to as Russ. So asking what name they prefer to use, what pronoun they prefer to use, conveying respect, being really present and aware of in that conversation. Reflecting the patient's language, avoid applying labels and not presuming, and really asking open-ended questions, which I think is probably not only a key for these encounters, but also all patient encounters and really just day-to-day life. Is there anything else that would help me ensure you get the most out of this visit, for example? And then just being aware or educated about some of the mental and physical health risks for the LGBTQIA+ population.
Absolutely, Shelley. Yeah, I think the conveying respect is a big thing, and everything that you guys just shared will make a big difference. So I know that the Lightbeam platform currently has male, female, unknown, and unidentified in our system, but what other capabilities does Lightbeam have for these populations?
Sure. So we can use the cohort builder to identify patients in this population. So we could use some of the ICD-10 and procedure codes that are applicable to the LGBTQIA population. So maybe some of those procedures that they may undergo or something like that. And the organizations can develop programs to address the gaps and higher risks with that particular population. So certainly we could create a cohort to identify those people and assign them to a care manager to make sure that we outreach to those patients in a timely manner and make sure that we address any of the pertinent issues with them. Also, we have, as Shelley mentioned earlier, because of some of the barriers in care and they're more likely to be victims of housing insecurity and also of domestic abuse and illicit drug use, we could utilize our SDOH tab, which we have the embedded prepare tool for assessing SDOH. And so we could use the assessments to monitor this population, as well as we could create additional cohorts that from the prepare responses. So we could use the cohort builder, identify any patient that, answered positively to being a victim of domestic abuse and make sure that we reach out to those patients. So definitely a strong usage of our platform within social determinants of health, adding barriers questions to current assessments that specifically pertain to the LGBTQIA community. And finally, along the same lines with utilizing the SDOH tab and the SDOH assessments and the cohort builder to identify these patients would be to become very aware of the resources specifically designed for the LGBTQIA individuals in your area, making referrals as appropriate. Will convey that you care enough to become informed about their particular needs, and the quality of the interaction can truly make a difference in someone's health. So super important to not only do these assessments, but to be aware of the resources that are available for this particular community.
Yeah, absolutely. And we're going to share a lot of those resources that Christine mentioned in the description of this podcast. We also are including CDC, HHS, and a few others for you to check out. Thank you again, Shelley and Christine, for coming on the podcast this month. It was great having both of you.
Christine, thanks for inviting me to join you again. Laurel, thank you so much for having us both. This is a topic that I think is so important, as Christine mentioned at the start. It is something that is becoming more and more on the national forefront. And I think a lot of education, a little bit of knowledge, and some sensitivity goes a long way. And I thank you both.
Thanks, Laurel. Like you and Shelley said, it may not be a large population, but it's certainly vital to ensure that everyone has a safe and welcoming environment and quality of care. So thanks for discussing this important topic with us today, and we look forward to being here for our next podcast.